1. What is the primary role of an interpreter in a healthcare setting? A. To translate written documents only. B. To act as a cultural mediator between the patient and healthcare provider. C. To provide medical advice to the patient. D. To simplify medical terminology for patients. 2. Which of the following is a key factor in ensuring effective communication between the interpreter, patient, and provider? A. Ensuring the interpreter is fluent in medical jargon. B. Maintaining neutrality and accuracy in conveying the message. C. Speaking quickly to save time. D. Limiting the amount of communication between the patient and provider. 3. In healthcare interpreting, what is meant by cultural competence? A. The ability to speak more than one language. B. The awareness and understanding of cultural differences that may affect communication. C. Ability to understand and memorize medical terminology. D. The ability to relate to patients based on personal experiences. 4. What is the most important step when preparing for a healthcare interpreting session? A. Researching the medical terms relevant to the session. B. Reviewing the patient's medical history. C. Building rapport with the patient and provider. D. Understanding the provider's personal preferences. 5. Which of the following practices is most important to ensure confidentiality in healthcare interpreting? A. Discussing cases in a secure private setting. B. Speaking loudly to ensure clarity. C. Asking the patient for personal information after the session. D. Translating information into several languages to make it clear. 6. What is a major challenge for interpreters when dealing with medical jargon? A. Medical jargon can vary between languages, making it difficult to provide an exact translation. B. Interpreters are required to memorize all medical terms. C. Medical jargon does not need to be interpreted. D. Interpreters should avoid translating medical terms altogether. 7. What is the primary focus of the Code of Ethics for healthcare interpreters? A. To ensure interpreters remain impartial and do not engage in patient care. B. To help interpreters gain fluency in medical language. C. To teach interpreters how to build rapport with patients. D. To encourage interpreters to offer medical advice when necessary. 8. When interpreting, the interpreter should A. Assume the role of a healthcare provider. B. Translate everything said without omitting or adding information. C. Focus only on translating medical terminology. D. Speak on behalf of the patient to the provider. 9. In which scenario would an interpreter need to use a sight translation? A. When translating documents without having a spoken dialogue. B. When translating a video recording. C. When interpreting a real-time conversation between a doctor and patient. D. When translating written materials like consent forms or instructions. 10. What is an example of active listening in healthcare interpreting? A. Repeating the patient's words without changing them. B. Focusing on the speaker's message, both verbal and nonverbal cues. C. Interrupting to clarify information for the provider. D. Speaking in a tone that matches the speaker's emotions. 11. How should interpreters handle situations where they do not understand a term or phrase? A. Guess the meaning based on context. B. Ask the provider or patient for clarification. C. Skip over the term to save time. D. Make up a term that seems appropriate. 12. What should an interpreter do if they feel they are not qualified to interpret a particular session? A. Proceed with the session anyway. B. Discuss the situation with the healthcare provider and request to be replaced. C. Refer to their training manual for guidance. D. Use their best judgment and interpret as usual. 13. How can an interpreter ensure that their message is being accurately understood by both parties? A. By speaking louder to ensure the message is heard. B. By checking in with both parties and asking for feedback on clarity. C. By limiting the amount of information they interpret. D. By simplifying the message into basic terms. 14. What is one of the ethical principles that interpreters must follow when interpreting for minors? A. Interpreters should avoid addressing sensitive topics with minors. B. Interpreters should ensure the minor understands the situation while maintaining confidentiality. C. Interpreters should speak directly to the minor, avoiding the adult caregiver. D. Interpreters should advocate for the minor's best interests during the session. 15. Why is it important for healthcare interpreters to understand regulatory compliance in healthcare settings? A. To ensure they are paid fairly for their services. B. To ensure they remain impartial and follow relevant laws and policies. C. To learn how to speak medical jargon. D. To interact directly with medical equipment in the room. 16. Which of the following is a critical factor when interpreting in emergency medical situations? A. Speed and accuracy of translation. B. Ensuring personal opinions are included for clarification. C. Encouraging the patient to provide their own diagnosis. Avoiding contact with the provider to ensure clear communication. 17. What does consecutive interpreting involve? Translating after the speaker has finished their entire message. B. Translating simultaneously as the speaker talks. C. Listening to the message and translating while making notes. D. Summarizing the message at the end of the session. 18. Which of the following is an example of an interpreter's role as a cultural broker? A. Providing medical advice to the patient. B. Clarifying cultural misunderstandings between the patient and provider. C. Giving the patient personal opinions about treatment options. D. Speaking in a language the patient prefers to understand. 19. In which situation would an interpreter need to use simultaneous interpreting? A. When the speaker is delivering a lecture or presentation in real time. B. When reading a document for translation. C. When engaging in a one-on-one patient interview. When interpreting for a group of patients. 20. What is an appropriate response when an interpreter encounters ethical dilemmas during a session? A. Act according to personal beliefs and values. B. Address the situation according to established professional guidelines and ethics. C. Leave the session immediately. D. Discuss the dilemma with the patient in private. 21. How should an interpreter handle situations involving a conflict of interest? A. Translate the message while remaining neutral. B. Explain personal biases to the patient. C. Declare their conflict to both the provider and patient and remove themselves from the session. D. Act as a mediator between conflicting parties. 22. Why is confidentiality especially important in healthcare interpreting? A. To prevent the interpreter from being sued. B. To maintain trust and privacy for patients. C. To limit the amount of paperwork involved. D. To keep the session within the legal guidelines of the healthcare setting. 23. What is the primary goal of providing feedback to adult learners in interpreting training programs? A. To enhance the learner's confidence. B. To identify areas for improvement and refine skills. C. To praise the learner for completing tasks. D. To allow for a break from the training. 24. How should an interpreter maintain neutrality during a session? A. By only interpreting when necessary. B. By using body language that aligns with the healthcare provider. C. By focusing solely on delivering an accurate translation without inserting personal opinions. D. By providing emotional support to the patient. 25. What type of feedback should be given to healthcare interpreters in training? A. Positive reinforcement only. B. Constructive feedback with specific examples of both strengths and areas of improvement. C. General comments with no detailed guidance. D. Feedback focused solely on mistakes. 26. How does mentor-guided learning benefit healthcare interpreters? A. It provides opportunities for real-world practice under the guidance of experienced interpreters. B. It encourages learners to adopt personal preferences in interpreting. C. It eliminates the need for standardized evaluation. D. It allows interpreters to avoid ethical dilemmas in the workplace. 27. What is the role of the interpreter during a medical emergency? A. To take control of the situation and provide first aid. B. To remain neutral, convey all necessary information, and ensure accurate understanding between all parties. C. To speak on behalf of the provider if the patient cannot understand. To prioritize speed over accuracy in the translation. 28. How can an interpreter improve their competency in medical interpreting? A. By studying medical dictionaries. B. By continuously practicing with real patients and providers. C. By avoiding medical jargon altogether. D. By working without supervision during practice sessions. 29. When faced with unfamiliar terminology, what should an interpreter do? A. Guess based on context. B. Leave the term untranslated. C. Ask for clarification from the provider or seek a term that matches. D. Use a simplified version of the term. 30. What is the most important factor when evaluating an interpreter's performance? A. Speed of translation. B. Accuracy and cultural appropriateness of the interpretation. C. The ability to understand the medical history. D. The fluency of the interpreter's native language.